The African Megalo family. Well, let's take an epidemiological standpoint of a particular organism for today. We are going to talk about cytomegalovirus from the epidemiological perspective. Consider yourself going to Africa and seeing this underdeveloped family which is holding a board called as no animals allowed, and they are all living in their own shells. Or you could also consider them to be surrounded by DNA. Well, these people are in Africa. They are having poor sanitation. They are having poor hygiene. They are repetitively having blood transfusion among family, and they are exclusively like, okay, only humans allowed here. Basically, causing only person-to-person transmission. Could be respiratory mode, or that of through placenta, or that of oral or secretions like that. And of course, the sexual route exists. I want you to carefully observe the diagram. I've done 4 people in particular, 2 men and 2 female, and the fact that one woman is more pregnant, she has this larger tummy, and the fact that and all of them are living in their own shells, or they're covered by this double-stranded DNA which is going all around them. Well, this will speak about some certain characteristics of cytomegalovirus. First being the fact that it's a double-stranded DNA virus. Second being the fact about the shell, that all of these are cultured through shell vial culture. Then each of these 4 individuals depict a particular way of manifestation of cytomegalovirus, which I'm going to talk. Importantly, remember that cytomegalovirus causes a tissue specificity, that is especially for kidney and that of salivary glands. And on that note, I also want you to remember the owl's eye appearance which is seen in kidneys. These are basically the cytopathic effect of the cytomegalovirus. Cytopathic effect of the cytomegalovirus. Wow. So similar sounding. If we ponder over the name cytomegalo, we have to look at the fact that cyto, if you break it down, cytomegalo, it's cell literally getting big, right? So that's the effect it causes. Cytomegalovirus causes the cells to become enlarged. That's one effect. Second being the fact that it's tissue specificity such as kidney and salivary glands basically causes latency. The virus stays back there and is like waiting. Okay, when will I get the opportunity to kill, attack? What will I do? That's planning there. It's doing latency there in kidney and the salivary gland. Adding an additional note on the beta subfamily of the herpes viridae family is something which we have to just remember. The next diagram talks about the cell to cell transmission of the virus, or cell to cell spread. Basically, none of the cell tend to become free because of it. So the CMV is almost closely associated with the cells, and they spread primarily from cell to cell, and because of which there are very little cells which are virus free, right? And one keyword which I wanted to focus on, that they cross the placental barrier, which leads to the main topic, that it's a congenital infection. This, my friend, this cytomegalovirus is going to cross the placenta and go to the fetus. It's like, I'm going to attack you, the pregnant female, and also your son or daughter who is within your womb. The word would be, it crosses the placental barrier, right? Or it causes congenital infections. We also read it under the same subtopic. Now, I want you to bring back your focus on individuals of those 4 people. Like, I want you to focus on each individual person. As I told you, there are 2 males, 2 females. One is more pregnant than the other. Let's talk about the first person. He is the ICP. He is the immunocompromised person of the family. Let's talk about how cytomegalovirus manifests itself in the immunocompromised people. There could be 4 case scenarios where there is an immunocompetent person, or there is an immunocompromised person, or there is a person who is somewhere around the term of the pregnancy, or there are people who have just, in the initial parts of the pregnancy. We are going to talk about cytomegalovirus's effect in these kind of processes, but let's take it as 4 people and break it down in that manner. That will be very easier. So the first person is the immunocompetent person. Let's talk about an immunocompetent person, how cytomegalovirus manifests in an immunocompetent person. Can you look at this diagram? This person who is raising his hands, and he seems to be a little bit happy. I don't know why. Maybe because he is not immunocompromised. Okay. Well, if he's an immunocompetent person, that means he has good immunity. That basically means that he is happy. Now, importantly, so if he's well in health, that means he's getting cytomegalovirus only through blood. So when he's getting it through blood transfusion infections, and when he's getting it, we can see that it is transmitted by blood transfusion infections, and that will give a specific type of syndrome which is called as mononucleosis like syndrome. Well, in this condition, here it's basically like infectious mononucleosis which is caused by Epstein-Barr virus. This is a condition in which there are atypical lymphocytes, which I've mentioned there. So there are some contrasting features also which we'll be discussing. I want you to put your gaze on the Paul-Bunel test becoming negative here. Well, this is a bit contrasting with respect to EBV, because in that there is Paul-Bunel test is positive, but here in Paul-Bunel test is negative. Paul-Bunel test is done to check the heterophile antigen. That's the key word, that with infectious mononucleosis and mononucleosis-like syndrome, the main difference is the negativity of Paul-Bunel syndrome, while Paul-Bunel wants to be negative in infectious mononucleosis-like syndrome. Ask me what is mononucleosis-like syndrome. I would say it is nothing but fever plus myalgia plus hepatosplenomegaly plus there is there is importantly another very important point called as the exception to pharyngitis or exudative pharyngitis and lymphadenopathy, which means that the exception to lymphadenopathy and pharyngitis means that in mononucleosis like syndrome there is no pharyngitis and no lymphadenopathy, whereas in infectious mononucleosis there is lymphadenopathy and exudative pharyngitis. Two important words there, the exception to infectious mononucleosis. The person with his shell, there is something called as foscarnet. Well, what is that? Just remember what is foscarnet. It is the drug which is used to treat cytomegalovirus, and I also want you to heed attention towards the marking which I have done, which talks about the genes and the antigens which are used to detect it. That is PP52, which is the protein which is DNA. It's the DNA binding protein, right? So individually for this immunocompetent host, I want you to remember all of this: foscarnet, PP52, blood transfusion reaction, Paul-Bunel negative, mononucleosis-like syndrome, and atypical lymphocytes. Now let's go to the next. Let's take a woman now. This is a woman who represents the congenital CMV, right? When you're talking about congenital CMV, can you see that woman at their kidneys? There is this owl's eye appearance. Well, there is this circle within a circle. It looks like an owl's eye, remotely at least. So that will remind us of the fact that that is the owl's eye appearance body which is seen in the kidney cells. These are basically the inclusion bodies which are seen within the kidney. This is a part of the cytopathic effect the CMV shows, right? Do you remember that it transmits from cell to cell and tries to keep all the cells occupied? So it makes sure that in kidney that it causes the cytopathic effect, and one of the manifestations is this inclusion body which is of owl's eye appearance. This manifests as a inclusion disease, cytomegalic inclusion disease, which is there in 5% of the children because it crosses the placental barrier, right? So it also infects the baby. So it happens in 5% of the babies. They ultimately can have psychomotor disturbances or conditions like that. Now I want you to take a note of the hepatosplenomegaly, which is evident in the diagram. This is the most evident form of disease which happens, that there is hepatosplenomegaly, there is rashes, and there is fatigue and conditions like that. This congenital woman represents the fact that cytomegalovirus is a congenital infection. I also want you to take note of the drug which is outside or within her shell, the pseudofovir and the immunoglobulins against cytomegalovirus itself. So this is done for that woman. Now let's get back to another man. This time let's take up the immunocompromised person. You can always imagine an immunocompromised person, right? He doesn't have any immunity, and in that condition that person will have really bad conditions. which will lead to poor prognosis. Here the same thing, there is latency of the virus, right? So this latent virus which is there in kidneys or salivary glands will get reactivated, and once it gets reactivated, it causes a particular condition called as CMV syndrome. So in CMV syndrome, the person has anorexia, night sweats, rashes and malaise and conditions like that. I wanted to take note of the fact that the person is too colored, right? So this immunocompromised condition can happen in two conditions. One is AIDS, the other one is in an organ transplant person, because there you give them steroids just to decrease the amount of T cells, B cells activating and all that process. So in AIDS patients, one who are having less than 50 per microliter of CD4 T cells present, like it's lesser than that, then they'll have really bad conditions. There is chorioretinitis, there is dementia, there is gastroenteritis, and that's going to be fatal for him. In organ transplant, whenever there is an organ transplantation happen, we have to always consider the infection of cytomegalovirus, which can easily happen. So it's the most common infection which happens basically after transplant of organs. This manifests 1 to 4 months later, and it manifests in different conditions, like interstitial pneumonia, or that of rejection of the graft itself, or that of there is leukopenia and conditions like that. Well, basically the transplant was successful, but in future it's not going to sustain for a longer amount of time. So for this person, the drug which you use is, just remember ganicyclovir. I'm not telling it any specifically. All I'm trying to say is that ganicyclovir, valgancicyclovir, and those kind of drugs are the ones which are used for CMV infections. So for here, remember gancicyclovir, and I want you to remember this UL54 gene, which is the gene which is used to detect this cytomegalovirus. And along with that, I also want you to remember the PP150, which is another one of those antigens which you basically detect from the cytomegalovirus. Then lastly, we'll talk about the last person who's remaining. Well, that's the female who's remaining here. The very pregnant person, the perinatal CMV infections. Well, that is what is going to be discussed now. Whether the infection occurs through breast milk or that of the birth canal itself, and importantly, most of the infected infants remain asymptomatic but shed the virus in their urine from 8 to 12 weeks of age up to several years, right? So that's the thing about perinatal CMV infection. And again, I want you to remember another drug here, that's going to be valgancicyclovir. And another gene which I want you to remember, which is used for the assay of it, is UL55. And then P65 is also an antigen, also an antibody which is used for detection of it. And this completes the cytomegalovirus with its treatment, its epidemiology, its transmission, and the cytomegalo family, which doesn't want anybody to come in.